Efforts to reduce violence in Chicago increasingly rely on community-based organizations that work directly with young people and families most impacted by it. Acclivus is among the organizations leading that work, focusing on violence prevention, youth development, and intervention strategies that aim to break cycles of harm and create real opportunities for change. Acclivus Chief Operating Officer Sheila Regan joins us now to discuss how the organization is working in communities across Chicago and what more needs to happen to support young people and prevent violence before it starts. Sheila, welcome to the Newsroom.
Thank you.
Acclivus has become an important part of Chicago's violence prevention ecosystem. For viewers who may not be familiar with the organization, can you explain the mission of Acclivus and the communities you serve?
The mission of Acclivus is to support the health and well-being of populations at risk for violence and other negative health outcomes. Our vision is to provide all individuals the opportunity to thrive regardless of their past misdeeds or misfortunes, some within and some without their control. We provide violence prevention services and related programs in 9 communities within Chicago and 2 municipalities outside of Chicago in the state of Illinois, including Champaign and Harvey.
Nice. Acclivus also works closely with young people who may be at the highest risk of becoming involved in violence. What are some of the strategies or programs you found most effective in reaching them?
I think our core strategy is relational. It's really about relationships. We have relationships with the individuals within communities that are likely to be involved in shooting or shooting someone. Those relationships and that trust and that credibility is really key to how we operate. So that really starts at the top of the organization. Our leadership team, the founders of Acclivus, Levon Stone Sr., Dr. Joseph Strickland, these are people who come from the communities affected, but are also a reflection of the target population that we choose to reach. Our agency employs primarily people from that target population, and that's really the change maker with us, is having those relationships, not being separate from the community, really being of the community, helps us inform strategies and interventions that are going to be effective and really work with the community.
Wow. Yes, and those relationships are really important. And speaking of relationships, many violence prevention organizations emphasize the importance of trusted relationships in the community. Why are those relationships so critical when trying to interrupt cycles of violence?
Well, for us, we provide health education. This is a public health fundamental, and the value, the ability for you to receive the information is really moderated by how much you trust the person delivering it to you. Whether you trust the source or not is going to decide whether or not you believe what information is given to you, whether it's accurate or not. So for us, we're trying to break cycles of violence, and to do so, we really need to deliver new information, new skills, new strategies, set new norms, and we really do so by bringing that new information from someone who is trusted. So our staff, our team, our leadership team, they really understand the dynamics. They have relationships with the individuals before they come to talk to you about violence. You will have already known this person. You have a relationship. You have a context for them. So when they're giving input or providing information, you're more likely to believe it and understand it and implement it. Again, like I said, this is public health 101 in a sense. We saw this during COVID. The data comes out, research says what's going on with the virus, what will work, what will not work. People get the information, but does everybody agree and believe it? No, it's clustered in groups. Groups tend to believe the same thing about masking, the same thing about vaccinations. So again, it could be the messenger that brings it. And for us, we understand and respect those pathways. That trusted relationship is there for a reason, but we provide the information and access to resources and opportunities along those same relational pathways.
That's amazing. What are some of the skills and opportunities that Acclivus is able to provide to the community?
Oh, that's a great question. So for us, one of the fundamental thing that we provide is direct jobs. We have about 120 employees that come from all these same neighborhoods. We also provide grants to other community-based organizations. These are hyper-local organizations that are experts on whatever specific neighborhood or municipality that the leadership there is from. We prioritize that indigenous leadership. Again, they're going to be self-invested in saying, if I make the decisions that are best for the community, those are the decisions that are best for me if I am of that community, right? So we provide access to resources, then we provide rigorous professional development training through our communiversity, our training academy. So the staff from these community organizations that we fund and other community partners get access to that education that we're providing, hands-on job training, on the job. After we finish training, they get robust training through, PowerPoints and different workshops that we have at the job. And that's just the workforce. So we have programs that offer clinical behavioral health, so therapy for individuals, couples, groups. We have workforce development initiatives, anything that's sort of complementary and supports the needs of any given community.
Wow. That's all very amazing work that you guys are doing for the community. We've seen increasing investment in community-based violence intervention programs in recent years. From your perspective, what's working and where do we still have gaps?
Great question. So I feel like what has been working with this new investment in violence prevention programs, I've seen more representation from the populations affected in the actual jobs, and a recognition, I think, that the people who are affected by violence, the people who are most disproportionately affected, have to be stakeholders in this game. They have to be able to get jobs. So, for example, I've seen more places be more flexible and understanding about someone who has a criminal background being hired onto a person helping type job, right? Where I think we could use room to grow or have improvement in this field would be access to resources and equity across those resources. Again, power perpetuates itself and protects itself. So there are resources concentrated in certain areas, comfortable pathways. So that's going to take time to overturn and to sort of move and spread the resources more directly in the areas that need them.
Wow. And looking ahead, what would success look like for Acclivus and for Chicago when it comes to building safer communities and better opportunities for young people?
Success would look like violence is no longer a health disparity. So people from my family are equally likely to be shot or shoot someone as people from Black and brown communities. That would be success for us, and we would be looking for opportunities for growth and development and personal and professional success for all the people that are currently affected by violence.
Nice. Thank you so much for all your answers. What would you like to leave our viewers with about Acclivus?
Acclivusinc.org. Check us out online. We put out public health information. We throw events, and we love community engagement. So check us out. Follow us on Facebook, Instagram, and hope to see you out in the community.